Good afternoon, Peter Goertz. I'm a psychiatrist. I got back from a trip outside of the country on Saturday, and we got back in the evening, and that same evening our dog was sick and I needed to take her to the emergency room. She was quite sick, unfortunately, still is. And I was in the emergency room for some time, ended up getting to bed quite late, and the next day I was on call, so I had to get up at 5 o'clock. So that reminded me of a general issue, sleep and doctors. And when I was an intern, I rotated for 3 months on internal medicine, 3 months on pediatrics, 3 months on surgery, 3 months on obstetrics and gynecology. And at one point, I remember on surgery, I was actually on call for 2 days in a row. So I went into work in the morning on Sunday and left to go home on Tuesday afternoon. And I remember we had a conference that Tuesday afternoon before I left. And the chairman of surgery said to me, "Peter, you look a little tired." He knew that I'd been on call. So it was not unusual, at least in our facility. And what we would do as interns, 2 interns were on call together, and we would try to let one of the interns sleep more the first night and then the other one sleep more the next night, so we could still stay awake for more or less 2 days without much sleep. And in general, of course, it's common sense. We want to avoid being sleep deprived as doctors. For our functioning, for our patients, it's not a good thing overall. However, like everything, it's not a black or white issue. So what are the pros of being sleep deprived, if you want to call them pros? So you do learn, I think, some time management. So you become very concise, or as concise as possible, as efficient as possible. And you triage things also, so whatever can wait till the next day, you try your best to have that wait until the next day. The cons are pretty obvious. So if you're sleep deprived, you're not going to focus well, you're not going to be as alert as you need to be, you can make mistakes. And one example of that is when I was doing pediatrics as an intern, it was at night, middle of the night, like 2 a.m. maybe. And I was in the emergency room, pediatric emergency room, and I was trying to get a nurse's attention, and she just kept ignoring me. And I was frustrated, tired. I wanted to get a little bit of sleep. So I just went to bed without talking with the nurse. And then sure enough, the next morning I found out the patient, a child, got too high a dose of Klonopin, too high a dose of medicine, and was overly sedated. So that's a real problem. So the more tired you get, the poorer your judgment gets in that respect, the more desperate you are to get a little bit of sleep. And then you can make bad decisions like I did. You know, I might have had to wait 15 minutes to get the nurse's attention, but at that point I just felt I really do need a little bit of sleep, and the nurse is ignoring me. And I guess I thought, hopefully things are okay. But for some reason, I did feel that there was something I needed to ask the nurse about, probably that the dosing may not have been correctly written. Another thing I did when I was on call as an intern was try and use even small amounts of time. Like if you have 15 minutes during the day where you have a little bit of time, just go up to the on-call room, get a little bit of sleep. Thank you very much.